The biggest fears for mums-to-be is tearing and pain during labour and birth. And up to 85% of women will have a tear of some sort during the childbirth process. So have a watch and a save of this video if you want to find out the ways that you can reduce the chance of tearing and episiotomy during the birth of your baby. So for anyone I haven't met, I'm Angie and I've been a midwife for 13 years this year. And the majority of tears during the birthing process are either a first degree or a second degree tear. Now with a first degree tear, these don't always need stitches. It's a skin tear, so it only involves the skin, and a lot of them can be left to heal on their own. Very occasionally though, if they've gone in a bit of an angle or in a funny place, sometimes a stitch or two might just be needed just to bring it back together so that it heals properly postnatally. The second most common type of tear is a second degree tear, and this involves some of the muscles. Most commonly, this is the perineal muscle. So the perineum is the place between the base of your vulva and your anus. The piece of skin and the muscle cavity is the perineum. Men also have a perineum between their balls and their anus. An episiotomy is a surgical incision that's made off to the side. Here in this country, it's at a 45-degree angle, again involving the vaginal wall and perineal muscles. So one of the first things you can do to reduce the chance of tearing during birth is perineal massage within your pregnancy. What I want to do to highlight this is just spread apart your thumbs from your fingers, and what I'm going to get you to do is just have a look at them. Do they look roughly the same distance as each other? Most likely for most people. What I'm going to get you to do is with your thumb is press down, okay, and massage really deeply and firmly from one side to the next for the next minute while I continue talking. So perineal massage, there are a couple of research studies that shows that from 34 weeks of pregnancy, undertaking perineal massage at least 3 times a week for 5 minutes a day can lower the chance of episiotomy and potentially a second degree tear. There is also a small body of research that shows that it can also help lower the incidence of 3rd and 4th degree tears. Now the evidence has been discussed on evidence-based birth, and it's well worth a listen into if you want to know more about it. But the risks of doing perineal massage in pregnancy are really quite low. And it's not just about helping with the skin suppleness, helping with blood flow, the skin elasticality of that massage that you can undertake from 34 weeks, but it's also about connecting with the perineal area. Many women are really nervous, really anxious about that crowning stage of the baby's head coming down and that burning sensation. From experience, the women who undertake perineal massage often have quicker second stages, so quicker pushing stages, because during pregnancy they've got to know about where they'll be needing to direct their energy, that pushing reflex too as well, particularly if they're planning on having an epidural, for example, as well in labour, where some of those sensations can be removed. By having done perineal massage, women can really start to feel where they need to relax their pelvic floor, as opposed to what we're used to in life is tensing and holding everything in. And so perineal massage helps with 2 things. Not only does it help with lowering the chance of tearing, but there are some small bodies of research and evidence that shows that it helps with the pushing stage being a little bit quicker. If it's a little bit quicker, that hopefully means that baby won't be as likely to get into distress. Not only that, but there'll be hopefully a lower chance of instrumental birth too. It is worth noting though that a lot of the evidence we have is correlational. The main risks of perineal massage during pregnancy are 1, that it doesn't necessarily work. Some women will still go on to tear even after doing perineal massage. The next risk is infection, so really important that you wash your hands before and after doing perineal massage. And the next one is potential discomfort. You should be massaging to the point where you can feel that stretch happening, but you shouldn't be causing pain with that perineal massage. And the next risk is not being able to reach comfortably. So this is where partners, they're really useful. They can get involved in perineal massage if you feel comfortable. Alternatively, there are some devices on the market if you wish to try this. Place your fingers back together. The one that you have been massaging, so I've been massaging this one, should now be slightly longer and able to stretch a bit more when you place your hands together, just highlighting that just doing a little bit of massage can massively help with the blood flow, with the skin elasticality. And what you've just been doing to massage that skin between your thumb and finger is the same motion to use during perineal massage. So placing the thumbs a couple of centimetres internally, again clean fingers, and massaging and just gently stretching downwards and out. So just downwards and out. For women who are doing hypnobirthing, this is a great time to practice your down breathing at the same time in those visualisations too. There are many other things you can do though to reduce your chance of tearing during birth. Number 1 is consider a home birth. Home birth has been shown to lower the incidences of tears and episiotomies. as has midwifery-led care units. You might be asking why? Well, firstly, there's very limited interventions at a home birth or a midwifery-led centre. There's no inductions of labour. Often these women are lower risk, so they don't have as many risk factors for babies becoming distressed or unhappy during their labour and birth. As I've said on many videos before, low risk doesn't mean no risk, it just means a lower chance of the risks happening. The other thing at home births and midwifery-led centres is that women labour more comfortably. They often adopt different positions, and those positions in itself can lower the amount of pressure on the perineum. These women often feel more comfortable as well because they have better continuity too in a lot of cases. In a home birth or midwife-led centre, there's a lot less active guided purple pushing too. So women involuntarily push and breathe their babies out more often in midwifery-led centres and home births. Now, wherever you are having your baby, being off of your back removes the pressure off of your perineum. Being on your side, being on your hands and knees will help with that perineum stretching more gently and reducing the chance of tears and episiotomies. Being off your back also increases the amount of oxygen and blood flow to the baby, so again, there's a smaller chance of baby becoming distressed during that labour and birth process. Fetal distress is one of the main reasons episiotomies is sometimes recommended or advised. So by being upright, forward, open, knees together, feet out, that really helps the pelvic outlet. Again, speeding up that pushing stage and also reducing the amount a woman actually physically has to work and make all that effort to push their babies out. The next thing is a warm compress applied to the perineum. The warmth in itself helps to bring the blood flow to the perineal area and helps with the skin elasticality. It also helps slow that baby's head down as well. So at that point of crowning where you just want it over and done with, you just want to push through, gives you a chance to really breathe and breathe through with your midwife and also have that slowing down of the head so that it's not just instantaneous out. It gently stretches the perineum so that it slips more easily over the baby's head as opposed to a tear happening. And warm compresses has been shown to lower the instances of tears. And as I've just mentioned, breathing at the time of baby's head crowning. So the moment that baby's head crowns, slow breaths, let your contraction do the work for you. No going, ooh, and just getting baby out. Let baby come out. When that head starts crowning, let your contraction do the work for you. Breathe through it. Eyes with your birthing partners or your midwife in the room and just breathe together. Just let that baby's head slowly come out. Panting is what we used to say, but it's just gentle breathing techniques, bit like when you're blowing out the candles. Hit the follow button for more pregnancy, birth and parenting information.